Alright. Okay, so you have the idea lah macam mana keadaan dekat ICU tu kan, ataupun sekarang ni during COVID punya era hari tu banyak kan in the news, you can Google lah dalam YouTube kan, lots of ICU punya setups. So these are the common causes for admission to ICU. Trauma, head injury, road traffic accident. So trauma will be covered in the next topics about traumatic brain injury ataupun head injury in MNT3. Post-operative, whether it's involve cardiac, abdominal or any transplant surgery. So surgical surgery has been covered in MNT2. CVD, cardiovascular disease and cardiac pun dalam MNT1. Okay. Transplant in you just expose dengan transplantation punya topic in MNT3 kan. Okay. Respiratory failure. Okay. Any patients that require CPR, cardiopulmonary resuscitation. So kalau tiba-tiba patient collapse, then they do PCR, then patient coming back. So biasanya they will admitted to ICU straight away lah. Okay. Oh, kat sini ada ni post CPR patient. Okay. This is quite similar lah. Respiratory failure due to other causes ataupun due to patient collapse. Severe sepsis, infections, severe bacterial or other microbes infections pun dah cover kan dalam MNT3, I think under topics infection lah, HIV and infection if I'm not mistaken lah. Okay, so to reduce ataupun slowing down the progression of organ damage tu, so they need this ICU care lah, sebab ICU beside there's a lot of machine. Lepas tu dia punya human resource is also higher compared to general wards lah. Mungkin kalau general ward tu one staff nurse to 3 to 4 patients. Kalau dekat ICU biasanya 1 to 1 lah. Okay, they have intensivists, they have anesthesiologists that manage dia punya pain tu lah. Okay. So those patients who are admitted to ICU, so we have these various tools to measure dia punya severity of the illness lah ataupun condition. Okay. Acute physiology and chronic health evaluation, Glasgow Coma Scale, sequential organ failure assessment, therapeutic intervention scoring system, simplified acute physiology score. So biasanya all these tools is specific for critically ill patient in ICU settings because dia punya parameter tu involve intensive care punya parameter lah, macam interleukin 6 punya score ataupun dia punya pain score, different tools dia adalah dia punya parameters. Okay, so they can classify this patient for severity lah, sebab because the severity will determine dia punya treatment lah. Same goes to kalau macam nutrition support in critical ill patient, also depends on the severity kan, whether we want to provide bolus feedings ke ataupun intermittent or continuous feedings to patient is according dia punya severity lah. Okay, and respond to the treatment yang kita bagi tu ataupun feeding lah in our case. ICU setup, so basically macam ni lah, macam tadi jugalah, patient so dia ada a lot of machines. In terms of medical record, it's more extensive compared to kalau in general ward. Okay, so dia ada so if you go to ICU, you have to identify all medical records for each patient. So dia ada dia punya continuation medical record, Lepas tu dia ada daily punya record sheet for documenting all the vital signs. Lepas tu all the punya nursing chart macam IO chart, input output, punya balance. Lepas tu dia punya blood pressure, pulse rate, biasanya dia ada dalam satu information sheet yang besar macam tu for each day. So satu hari tu satu, it's for 24 hours lah. It's either half an every 30 minutes to 1 hour punya charting lah. Okay, beside dia punya medical record and also dia punya medication sheet lah in one folder. Kalau yang masih gunakan file lah, folder. Kalau yang apa tu digital hospital ataupun paperless hospital, all in computer lah, lagi senang nak cari kan. Okay, but they still have this daily punya charting sheet tu masih ada for even for yang digital hospital. Okay, other equipment, ventilator, mechanical ventilator machine for breathing support. So there are various types of ventilator lah. Depends on dia punya severity, mode, apa tu breathing support to patient lah. So ada yang less in terms of dia punya side effect to patient, ada yang tinggi lah, bergantung kepada ability of patient to breathe on their own. Okay. Then kita ada continuous renal replacement therapy, CRRT. Also different modality depends on the punya requirement of patient lah. How severe dia punya kidney tu, acute kidney injury affect the patient at that particular times lah. Okay. Alright, then in ICU, the ICU team consists of various medical healthcare provider. Sama juga lah macam dekat general ward kan, ada intensivist, the medical team lah, intensivist, anesthesiologist. Okay, kemudian physiotherapist, pharmacist. Yang paling ramai is the nurse lah, because one nurse to one patient, sometimes two nurses to one patient juga. Okay. So the roles of dietitian in ICU biasanya in nutrition support and also in terms of to provide input kepada healthcare team in terms of patient punya nutrition status punya progress lah. Okay. To discuss with doctors about the route and also timing of nutrition support. Kena discuss juga dengan pharmacists and nurses in terms of dia punya medication timing, bila kita nak stop feeding, access for the support to provide punya products, dia punya amount that we want to deliver to patient. Okay, dia punya requirement, whether we want to use to determine dia punya products lah, yang mana kita nak pilih kan, and also transition from parenteral to enteral or parenteral enteral to oral, and the nutrition care plans for patient bila dia nak transfer from ICU to general wards. Again kita kena plan juga if patient is severe. So mungkin dekat general ward there's no pump, so kena plan dulu before patient being transferred out to general ward. Okay, next is in terms of metabolic response in critically ill patients. So there are two conditions. One is starvation, the other one is stress lah. Okay, this condition occur because kita punya body need to adjust ataupun adapt to the effects of changes tu lah. Okay. So starvation basically is inadequate nutrient intake inadequate intake for the body to survive for periods with insufficient foods. So the factors of inadequate intake is various, whether physiological issue ataupun because of dia punya availability ataupun mechanical issue, patient tak boleh nak swallow ataupun ada blockage. So whatever reason, kalau patient being starved, so dia punya changes akan berlaku lah. Okay. Part of energy supply from endogenous reserve. Then protein loss associated with a decline in organ function. So because of the critical damage occur, sama ada because of surgery ke tadi, surgery, trauma ataupun infections. So these vital organs will be affected, then lead to increased protein requirement ataupun protein punya metabolism. Then the body conserve energy and minimize protein losses and maintain supply glucose to brain and nerve system. Because we know that the main energy sources ataupun main energy sources for brain is glucose. Only after adaptation that ketones will be can be adapted by energy sources. Okay. So destarvation will increase this condition to produce energy. First line is glycogenolytic. So bila starvation, insulin will be reduced, glucagon will be increased, so that this glycogenolytic can occur daripada glycogen storage, sama ada muscle and also liver glycogen storage. Then body start produce glucose from other sources, daripada protein and free fatty acids. And lastly, they use these ketone bodies as energy source lah. Okay. So in critically ill, we know that in starvation and condition, the body require the energy is mainly from protein sources, but yet the total calorie requirement prevent protein losses in a critically ill patient. But during critically